A health policy analyst from Saskatchewan who is living in Australia has learned some lessons about COVID in that country. And he's carefully watching how things are playing out here at home. Stephen Lewis joins me now. Thanks for being here.
My pleasure.
Stephen, first, tell me about life in Australia right now.
It's pretty normal. We have no cases. I live in the state of Victoria, which has 6.5 million people. We haven't had any cases for over a month, and we haven't had more than 10 cases for 7 or 8 months. Everything is open, including sporting events. You can't have 100% capacity in a footy stadium, as they call it, but you can have 75%. All of the commercial enterprises are open. There are a few places where you still have to wear masks, but those restrictions have been mostly lifted lately, and there are no limits about how many people you can socialize with.
And why is it that Australia is essentially back to normal?
Australia is back to normal because it had really suppressed the pandemic, and it put in place some pretty severe measures to drive the numbers down to insignificant, that is below 10 or even 5. And what Australia does is whenever there is a new case, which invariably thus far has come through international visitors and from the hotel quarantine process where you have had some airborne transmission and a few cases have started, they immediately leap into action and do what they call circuit breaker lockdowns, which means depending on the state and depending on what they know or don't know about the where the case originated, they just grind things to a halt. They are typically a few days, usually 5, and so far they've all worked. So those 3 cases have not become 50, and there are no new cases afterwards, and then things go back to normal pretty quickly.
You've been talking with doctors and epidemiologists here in Saskatchewan and say the Premier's approach to the pandemic control strategy amounts to your money or your life. Tell me about that.
Well, the Premier has all along said we are not going to do these hard lockdowns because we don't want to have that big an impact on the economy. We think it will be better for the economy if we manage the pandemic, and as long as the numbers aren't too great and as long as the healthcare system isn't overwhelmed, he's not going to do the kinds of very hard, very decisive lockdowns that have succeeded elsewhere. And I think the tragedy of that case is that it doesn't work for the economy either.
Across Canada, we've seen leaders make different decisions about when and how hard to lock down. How do you think the Saskatchewan government stacks up?
I think the Saskatchewan government has done more or less the same, perhaps a little bit belated in its response for the provinces west of Atlantic Canada. But Atlantic Canada has done substantially better because it adopted more of an approach that was successful in places like Australia, Taiwan, South Korea, New Zealand, where they got on top of it pretty early and they kept measures in place to keep the numbers down. And the results are plain to see. They have done better in the number of cases they've experienced since the beginning, the number of hospitalizations, the number of deaths, and the number of currently active cases. So they avoided a lot of harm. And then the question is, so what did you get for not locking down? Well, the irony is the economy hasn't done that well because in a recent study in the prestigious scientific journal Nature, the researchers looked at 33 jurisdictions and say, how have they done since the beginning? And what has been the impact on the economy? And the results were, in a nutshell, that if you delay your lockdowns and you don't make them comprehensive enough and firm enough, and you don't make the rules clear enough, you might do all right for a little while, but then your numbers are going to get out of hand, and then you have no choice. So you end up doing what you said you wouldn't do in the first place, which is put in place much more widespread and strict measures. But by the time you do so, your numbers have gotten out of hand, so it takes much longer to flatten the curve, which means over time and over the last year, the cumulative period of lockdown is actually longer, and that's actually worse for the economy.
Those of us in Regina have been living under the tighter restrictions for quite some time before Christmas. Now even tighter restrictions with closed restaurants for dining. There is some restriction fatigue for sure. How do the politicians keep citizens engaged?
Well, it's hard to keep them engaged if your strategy doesn't work and consistently doesn't work, and when you have to go in fits and starts. So I have a great deal of sympathy for people in Saskatchewan who've had to deal with this now for a year. And it's okay if there is a rosy end in sight, but there isn't. And now we have these new virulent strains, which are more contagious and more lethal, and that's created more anxiety. So I think the lesson is nobody, no group of people wants to endure this forever. And the lessons from the successful jurisdictions is it is better to impose the hard lockdowns and have, widespread, very clear measures where there are consequences to violating them for a finite period of time, because the benefit you get from that is that when you get the numbers down to 5 or 3 or 2 or 0, you can reopen and return to normal and keep it that way. So the playbook is out there now. It wasn't at the beginning, and you could cut the premier and the province some slack for not knowing what to do at the beginning. But there is no excuse for not knowing what to do now, because there are successful examples and good analyses of what happens if you do it right and what happens if you don't do it right. And we need to start doing it right.
Stephen, thank you so much for your time.
You're very welcome.